When we're looking at normal sleep deprivation in the postpartum period versus an impending postpartum depression or anxiety, it can be very confusing and you do need to tease it out. Generally speaking, when you're looking at a normal adaptation, to having a new infant or another infant in the house, or, sleep deprivation from an infant, patients are exhausted. And so, when given the opportunity to sleep, if it's just sleep disruption from having a new baby, they will usually readily fall asleep. They welcome an opportunity to sleep, and they don't want someone to come and wake them up. Other than being tired, when they're refreshed, they are happy. That's generally what you see. When we're looking at an impending postpartum depression or anxiety that's keeping someone awake, that's a whole different ballgame. That usually involves unwanted and intrusive thoughts. Um, they're constantly worried about the baby, and so sleep does not come readily to them at all. There is not a feeling of feeling refreshed once they have slept, and it's ongoing, unwanted, intrusive thought. I would go on to say that if you're looking at postpartum psychosis, right, which is very different than postpartum depression, and it can be more obvious in general. You do want to make sure that someone is based in reality, that the patient is based in reality. And that's not just do you know what day it is, do you know what time it is, but are they tilting their head and are they appearing as if they're hearing voices that no one else is hearing? Are they seeing things that other people are not seeing? Are they looking suspicious or paranoid? Are they looking around the room in a suspicious form? And that can also be very subtle. And patients, if they're aware that something is off for them, which they may not be, they can work very hard to conceal what they're thinking or hearing. And so, honestly, a clinician should be asking outrightly in the postpartum visits, or if there's a visit because family is worried and they've brought their loved one to a clinician. We have to be comfortable saying, "Are you hearing things that other people may not be hearing? Are you seeing things that other people may not be seeing? Do you have thoughts of hurting yourself or your infant or anybody else in the household?" Those are really important points to determine whether someone is based in reality.